Hello, everyone. It's Monday, February the 8th. Unfortunately, I've got to report to you that we've lost another 31 West Virginians. You can see that we all know 31 is way too many, but at the same time, we all know too that this report includes Saturday, Sunday, and I guess into today, so it's an extra day compared to when we do it on a Monday, a Wednesday, and a Friday. Sometimes the reporting over the weekend doesn't get everybody in and everything, but at the same time, it is an extra day, and these number of deaths are surely significantly different than where we were just a few days ago. And so, you know, while 31 is terrible, we surely are happy to see that it's not 83 or 77 or something, number that was really high. But out of super respect in every way, we're going to read everyone again. The 2101st death is a 93-year-old male from Monongalia County. The 2102nd death is a 64-year-old male from Mingo County. The 2105th death is a 69-year-old male from Wood County. The 2106th death is a 67-year-old male from Wood County. The 2107th death is a 71-year-old female from Wood County. The 2108th death is a 90-year-old female from Wood County. The 2109th death is a 73-year-old male from the 113th death is an 88-year-old female from Wood County. The 2114th death is an 86-year-old male from Harrison County. The 2115th death is an 82-year-old male from Greenbrier County. The 2116th death is a 69-year-old female from Mercer County. The 2100 2119th death is a 79-year-old female from Mason County. The 2120th death is a 94-year-old male from Upshur County. The 2121st death is a 76-year-old male from Wood County. The 2122nd death is a 76-year-old male from Raleigh County. The 2123rd death is a 52-year-old female from Kanawha County. The 2124th death is a 72-year-old male from Hardy County. The 2125th death is an 84-year-old male from Marshall County. The 2126th death is a 78-year-old female from Mingo County. The 2127th death is a 73-year-old female from Kanawha County. The 2128th death is a 73-year-old male from Wood County. The 2129th death is a 69-year-old male from Gilmer County. The 2130th death is a 69-year-old female from Berkeley County. The 2131st death is a 73-year-old male from Berkeley County. Always keep these people in your prayers. They'll know it. They'll know it. And without any question, don't let them become just what I've said over and over, a number, a statistic. These are great West Virginians that we've lost, and we've lost a tremendous amount of wisdom, and they're people that have loved ones and friends, and they're hurting. Keep them in your prayers, please, West Virginia. I know you are. We have 398 new positive cases in the last 24 hours. That's way down. But again, it's the weekend. Our daily positive rate, is 5.73. Our cumulative positives stayed at 5.60. Our active cases are now down to 15,557. That's 23 straight days that has been lowered, and that's great. Our recovered cases are 107,418. I always tell you, watch that upper graph. It continues to move with active cases on the bottom, with the dark blue moving down, and the light blue is the recovered cases moving up. That's exactly what we want to have happen. We have 375 people hospitalized and 107 in the ICU units. You know, I love this right here, you know, and so please pull up our color-coded map and look at West Virginia now. Just look at West Virginia. We only have 3 counties in West Virginia in the red. We have 4 counties in green. You know, it's better, and it's better. Still not great by any stretch of the imagination, but it is one whale of a sight better than it has been in the past. From a standpoint of, you know, I always caution you and warn you about if you're 65 and above, the antibodies are sitting there waiting on you. If we know that you're positive, we can save your life probably. But if we can't save your life, if you sit at home with all the symptoms in the world and, you know, or maybe just a few, and then things get worse. And by the time you sit there and finally decide to go get a test to just see if you're positive or not, it's too late. It's too late for the antibodies to do you a whole lot of good, and then we're fighting the fire that could very well take your life. So go get tested. At the first signs of a heart attack or a stroke, what do? You run to the fire. You go to the hospital to get whatever relief or whatever you could possibly get. Without any question with this, don't think it's just a cold. Don't think, you know, it's just a headache or I'm just unusually tired today. Don't think that. Go get a test, please. On our vaccine distribution update, you know, we finished last week's allocations with 106.1% going in somebody's arm. You say, how in the world are they getting over 100%? You know, well, it's just real simple. We're getting more doses out of the vials, and we have an 87.2 administration rate of our second doses. You know, it's incredible. It's incredible just how we're doing this and how well West Virginia is doing. And absolutely, without any question, I am so proud of all the people that are out there that are, you know, tirelessly carrying on this effort, and it is amazing what they're doing. You know, our goal is to always get 100% of the shots into arms every week, and we're going to do just that in all 55 counties as we continue to do our Saving Our Wisdom clinics. Now, to date, we have administered, now get this, 375,781 total doses. That's first and second round doses. 325,781 in West Virginia. We continue to lead the nation, you know, because our partners at the local and the county levels are doing great work, along with the Guard and all the good work that they've been doing. You know, all of our counties and our community partners play an important role in getting West Virginians vaccinated, and I sure thank them, and we should all be so thankful to them. As of this morning, you know, we are still leading, West Virginia is still leading the nation in vaccine administration. A total of 5.82% of our entire population in West Virginia has been vaccinated, and we have used 99.1% of all allocated doses from the federal government. It's amazing. We're leading the nation in both categories. From our vaccine scheduling system, you know, pre-registering does not mean that you're going to lose any part of your access on your list that you're waitlisted on. You know, when the vaccine's available, you'll be notified from the system based on your preferred method of communication, whether it be a text or email or a phone call. We launched the thing in, just really 2 weeks ago today. We have more than 216,000 West Virginians pre-registered now. And this week, many of our local partners will begin using the system to pull lists of eligible vaccine recipients and contact them for appointments. And General Hoyer will go over more of the details and everything in just a few minutes. As far as our Saving Our Wisdom clinics this week, vaccine clinics will again be held in all 55 counties in West Virginia through our Operation Save Our Wisdom. The clinics are available for West Virginians that are 65 years of age or older, and this list is completely available on our website. Residents from any county may access any of the appointments anywhere. Many of the clinics are utilizing existing wait lists. I again want to encourage anyone over the age of 65 to go online and register and get into this system. We do not naturally, we've said it over and over, we don't have enough doses to go around, but we continue to push and push and push to get those. So far there has been, and this just tickles me to death, but so far there's been 100,286 first-round doses and 34,288 second-round doses to people above the age of 65. Now, just to put this in common everyday terms, it's just as simple. There was a day about 4 weeks ago, the day when we decided to go back to school, for all of our kids, 8th grade and under, and to go to our color-coded map and to not change our map, to not make it easier to go to school, not change our map, in regard to, what counties were in the red or the threshold to go in the red or the orange or whatever it may be. So on that day, we decided it's important beyond belief to go to school because our kids are failing classes. Our kids are really in need, especially our special needs kids. There's bad things happening to our kids that we don't even know about. We need eyes on our kids. And that day, we decided to go back to school. And in addition to that day, we decided to put in another level of safety. We were going to vaccinate all of our teachers and service personnel above the age of 50. We did that all that day. But we made two other monstrous decisions that day. We made a decision to not let our vaccines sit on shelves like they still are to this day all across our nation. I don't know exactly what the number is, but it's something along these lines. We have 54 million in some warehouse somewhere. They're not in a warehouse in West Virginia. And in addition to that, that was the third thing that we decided. We decided to go to school. We decided absolutely to stay with our map. We decided, and those are one and the same. We decided to vaccinate all of our teachers and service personnel above the age of 50. Second thing. Third thing, all across this land, we decided we would not let our vaccines sit in the warehouse. And the last thing, which is probably this that I'm talking about here, 100,286 individuals above 65. First test, first vaccine. Second vaccine, 34,288 above 65. Now just think about it. That day that I'm referring to, that day, and what a day it was. That day we decided to give hope to these people, to our elderly, and to move. That day, probably now 3.5 weeks ago or whatever, maybe 4 weeks ago. And that day, our elderly that didn't think they were going to get their vaccine shot till April, the general public, we moved, did we not? We gave them hope. And now we've vaccinated over 100,000 on first shots and 34,000 on second shots. How many lives were saved? It's good stuff. So I commend all those that were involved in any and every part of this whole thing, especially the Guard, especially all of our health people, especially people, our coronavirus czar and our general, all the different people that have really made all this happen, and all the people on the county levels, the local levels that are just making it happen every day. It's good stuff. I've been telling you over and over, we keep trying in every way and keep pleading with the federal government to get more and more and more vaccines. I'm really proud to announce today that we're expecting an additional 5,800 doses per week, initially, that are going to our pharmacies. This is a federal pharmacy program, and we are partnering with Walgreens to offer vaccines to those 65 and older and members of our critical healthcare workforce. So this is another bump, and it's a bump above, what we're getting, and plus, in addition to that, we're supposed to be getting some level of bump up to the tune of close to 20%, on our 23,000 allocation. I don't know exactly what that is, and so don't hold me to that, but the net of the whole thing is we are getting close to 6,000 additional doses per week that we're talking about here, and that's going to help. That's going to help a bunch. I encourage everybody to take advantage of our free testing. I encourage everybody to watch our testing map and be able to go online and try to figure out anything. And if you can't, and you just want to call us and have us help you, we'll help in any way we possibly can. Again, thanks to Walgreens and Frith for all the good stuff that they're doing, with the drive-through pharmacies and everything. It's been great. Our COVID vaccine line is up, and I'm not going to just go through reading all this different stuff to you, but I remind you about getting the vaccine. I've said it over and over and over, but these vaccines are incredibly, incredibly safe, and they're very, very effective, and you know what the other alternative is. The other alternative is just roll the dice, go on about your business, and then all of a sudden awaken to a potential tragedy. And that may very well be you, if you're not vaccinated, and it can turn into an absolute tragedy. Just think about just this. Something's driving this to happen, isn't there? Something is driving these deaths to not be 80 and 70, isn't it? Something is working. Where do you hear of people that have had vaccines that have had a reaction that is off the chart bad? Where do you hear on our nightly news and everything of people that are dying taking the vaccines? Where do you hear of people that are getting vaccinated that are constantly getting COVID? Now, don't tell me about an exception beyond belief. Just tell me about the rule of thumb. You can't hear it because it's not out there, because that's not the case. The vaccine is incredibly effective. The vaccine is lowering deaths. The vaccine is saving lives everywhere we turn. You need to take your vaccine. That's all there is to it, because the alternative is not good. It is just plain not good. As far as the antibodies and everything, I've told you a bunch there. We've got them in the state. If you'll get tested and you show up positive and everything, we'll get them to you. Boy, this is great stuff here too. Our long-term care facilities have 45 outbreaks now. That's down from well over 100. That's great. Now get this. In the state of West Virginia, we have 2 outbreaks in our churches. 2 in 2 counties. It's amazing. Great stuff. So to our church community and our long-term care facilities and everything, congratulations, way to go. That's really good stuff. I remind you again about churches. You know, if you're 65 and above, you may still want to think about it just a little bit and everything. And I'm very respectful to whatever your decision may be, but you may want to just think, if I can get my services online and everything, and maybe that's the very, very, very best thing at this time. But if you decide to go and everything, remember everybody, wear your mask, please. Keep that pew in between you, and wash your hands, social distance, do all the stuff that we've been preaching over and over. It's working, and absolutely, if you'll just hang with it and everything, it could very well save your life. As far as corrections, again, accolades again, I'm proud of them. We have 50 inmate cases in the state of West Virginia and 22 staff cases, and this includes 29 at the Southern Regional Jail and 12 at the Central Regional Jail. Once this is there, it probably is going to bump up and everything, but we continue to run to the fire, and really, we've done amazing work in corrections. You know, I told you over and over about wearing your mask. This is your first line of defense, and I've asked you repeatedly, if you have been blessed by God above and everything, with the blessing of being, gotten through this terrible killer, and you had COVID and everything, you've gotten through it, please consider giving blood. I'm a firm believer in truth. I'm not a believer in politics, and you can say whatever you want and everything, and you see all the bad stuff that's going on. I challenge people every day, find something that I'm not telling you the truth about. I'll make mistakes, but I'll always tell you the truth. You're doing better, West Virginia. We're going to get through this. It's better. All you got to do is look at the numbers. All right, thank you so much.
All right, thank you, Governor. Let's now go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good afternoon. As the Governor pointed out, we had another successful week, 106.1% first doses administered, 87.2% of second doses. Want to highlight that things continue to work this week to move us again in that direction. And the Governor talks about the folks behind the scenes that are making this happen. So just think it's important to highlight to folks some of the things that are going on this week to continue to get those numbers where they need to be. Number one, we'll break down several thousand ancillary kits and replace the needles in those kits with a 25 gauge needle to make sure that we have the appropriate equipment to get the total number of doses out of Moderna vials and that extra dose. So a lot of work going on behind the scenes to fix that issue with the syringe size that we received. That will help us significantly. In addition to that, there's been a great deal of coordination go on this weekend with Walgreens. As the Governor pointed out, we opted into the second phase of the federal pharmacy program because it meant an additional 5,800 doses to the people of West Virginia initially. Walgreens has agreed to participate as part of our interagency task force, and we will be pushing lists to Walgreens from our Everbridge system in conjunction with each county location where those Walgreens are. So a coordinated, consolidated, and synchronized effort to get doses out, continuing to focus on over age 65 and those critical areas that the Governor pointed out allow us to improve our numbers, reduce the death rates in West Virginia, and reduce the hospitalization rates. In addition to that, a lot of work continues to go on to improve the Everbridge system and get it fully integrated with the list that we have out there that exist. So we ask West Virginians to, number one, continue to register, no matter what, register. So it helps us plan and helps us prepare to be able to identify target populations that we need to more efficiently and effectively. In addition to that, be patient with us as we continue to improve the system going forward and challenge us by calling the hotline if you have an issue or a problem. We greatly appreciate the work that's gone on in those areas. Also remember, registering does not mean an immediate vaccination. What it does mean is you are in the system and you are helping us identify how to efficiently and effectively administer doses as they become available. It also allows us to communicate with you so that you can understand what is going on out there in addition to what the governor and his team put out on these press briefings on a regular basis. Again, we appreciate the great work of all the people involved, from local, state, and federal level partners in the interagency task force, and the great work that they can continue to do. Thank you.
All right, thank you, sir. Next to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. To follow up with what the governor said and with what retired Major General Hoyer said, we are doing really, really well right now. And I say that not to cause people to be complacent, but like the governor said, everything is really moving in the right direction. And we believe the reason why that's so is because of you. You're really taking the opportunity to show up when it's your turn to get vaccinated and choose to be vaccinated. You're wearing your mask and being careful about performing those measures that we know not only protects you, but protects your community, your neighbors, your family. So important. And we also know that as we go forward, there is an increasing sense, I think, of all of us, that the reason why we've been so successful is because we've stayed together. You know, the people that work behind the scenes, as the general said, on this pandemic, and all of us on the call, including the governor, have that opportunity to see the selfless work of so many. They do what they do not because it's their job. They do what they do because they love this state. They love the people in this state. And we all want to do everything we can to save every life, to improve everybody's well-being, and to make sure that people make it through this pandemic, not just by surviving, but really by thriving. And the way we do that is we do it together. And as the governor said, and as the general said, it is really important for you to register on the new Everbridge system. And the website is vaccinate.wv.gov. And the 1-833 number we'll post again. But that's important that if you don't have access to the internet, call and we'll help you. And as the general said, it doesn't mean you're going to get your shot next week, but what it means is we really will benefit as a state if we have everybody registered in this system so that we can not only, sort and prioritize the people who need the vaccine first. And the governor has created the Save Our Wisdom, which I think has been extraordinarily powerful. Remember, half of our deaths were in nursing home residents, and we were the first state in the country to finish first and second doses in over 85% of our nursing home residents, which is quite extraordinary. But also, it's really important we do that so that we have one list to be able to use. And ultimately, what we hope to be able to do is to take advantage of the additional doses that are coming from this country. But we help West Virginia rise because of the beauty of our state and of our people all working together. Thank you.
All right, thank you, Dr. Marsh. Next to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. I just want to remind everyone that we do have our testing sites available. If you go on our website, you can find the locations. And I do want to remind everyone that if you're feeling sick, to please get tested. Even if you've been vaccinated, you still need to wear your masks as well. But we are seeing some people who are still having, sinus symptoms or not feeling well, exceptionally tired, that it is still important to get tested. Also, we had a couple of questions about wearing 2 masks. It is important to wear a well-fitted mask that's covering your nose as well as around your chin. If you do feel comfortable wearing 2 masks, that's acceptable as well, but definitely wear 1 mask still, even if you've been vaccinated. Thank you.
All right, thank you, Dr. Amjad. We'll now go to questions from members of the media. The first today from Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. First of all, most importantly, perhaps, congratulations to Baby Dog, celebrity predictor, on her very close Super Bowl prediction. Final score, as you probably know, was Tampa Bay 31, Kansas City 9. Baby Dog predicted 31-20. Of course, that's more accurate than I've ever been. But my actual question, both chambers of the legislature during previews in the past week or so have indicated they are looking at further defining the governor's emergency powers. Not just you, but governors from here on out. Those emergency powers in either their scope or their duration. Do you think that's worth a look? Thank you.
The first thing, I would say is I've surely been working all the time with the legislature, and you've got complete transparency, total transparency on my side. I'm going to do the same thing for another 4 years. If I would go back to just what my dad would have taught me a long, long time ago and said, if it's working, don't fix it. Now, and really the bottom line is it's worked. It's not only worked, it's worked unbelievable, and we have handled the economics of this state. We've handled the need from the cities to the counties to the small businesses to the workers' comp. I mean, honestly, you tell me where we have not knocked it flat out of the park. And so from the standpoint of how we've handled the emergency powers within the governor's office and handled this terrible pandemic that rolled around one in 100 years, and just, sure, it could have been handled differently, but I'll promise you it could have been handled very, very poorly differently too. And so we got to remember that, it's, the reason I smile and everything is you ask about Baby Dog. She was back in the tunnel. They just let her out, and she just rolled right in here beside me. And I'm gonna, if she'll come around, come here, girl, come here. She wants to talk to you just a second too. Come on up here, girl. Little baby. I know you're a big rascal, but she wanted to tell you this, Brad. Thanks for mentioning everything, how she did on her predictions. She told people that how to bet. Nathan in our office decided he would bet with Kansas City. He was a dumb bunny, but at the same time, Baby Dog can only do what she's said in the past, and she whispers to me all the time, and she says, listen to the Baby Dog. And so you got to do that and everything. But I only say all this in jest. I can tell you that one person, decided to take Baby Dog's numbers of 31-20. Late in the game, if Kansas City would have scored, they would have probably had to go for 2 points. And at that point in time, if they'd have kicked the field goal, we were sitting dead on 31-20. And about that time, this good friend of mine called and said, for God's sakes a living, he called me Coach. He said, Coach, do you not realize I bet $50 on Baby Dog's score, and if it hits and it looks like it could, I'm going to win $11,000. So anyway, we didn't do quite that good, but she did surely predict the winning team and gave people the opportunity. If they'd have just bet at Tampa Bay under, they'd have done pretty daggum good. So with that, I only say this in jest because the good Lord gave you the ability to smile and to laugh. And this stuff's been tough stuff, hasn't it? And really and truly, we need to smile and laugh just a little bit. And you just think about the two coaches that were on the sidelines, you know, Bruce Arians and Andy Reid. Bruce Arians came to the Greenbrier with the St. Louis Cardinals, you know, or the Arizona Cardinals rather, you know, a few years back, and I got to meet him and everything. What a wonderful guy. Absolutely a wonderful, wonderful man. A man that loved to laugh and a man that absolutely loved to smile, just like what I've just been telling you about what the good Lord has given us. And Andy Reid, we all know him. Now, I've never got to meet Andy Reid, but we all know him for his personality. So there you have two of the greats that truly know how to smile and truly know how to laugh. And really, at the end of the day, I subscribe to that. And so does Baby Dog. So anyway, we thank you a bunch, and I'm going to set her down because she's like a big, giant brown watermelon. But anyway, she's my buddy. Thank you so much. There's a bet with Baby Dog, you know, she'll accept any donation to the Humane Society for West Virginia. But anyway, thank you all so much. Thank you, Brad.
All right, thank you, Brad. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. I have a question about the morale of the frontline workers in the state, from the health departments to the National Guard. This has been a long lift. This has been a heavy lift. Dr. Amjad, General Hoyer, are you doing anything to monitor that, or do you have concerns about that as we go forward?
And I'll let you go first if that's okay, Governor.
Sure.
Please, y'all go.
Sure, Paul. I mean, you're absolutely right. Our health department staff has been working for over a year, and prior to this, they worked very hard already. So, as far as monitoring it, each health department has their own way of internalizing it as far as monitoring it. But you're right. I mean, this is an ongoing effort. There's a lot of well-known depression already in healthcare workers, I would say in general, being working very hard. So this is something that's on our radar. There's not a lot of time off. We have shortages already in that field in local health departments. So we're cognizant of it. We're trying to get a lot of volunteers. We have volunteers already who are stepping up to help in. That's why we have community partners in there to, give some time off, but there is not a lot of time off. So that is something, we ask the public to be wary of and to be patient with them. Also to give kind words to people and to be understanding when they might not think they're getting, answers right away. But you're absolutely right. This is a long haul for a lot of people and for a lot of healthcare workers, frontline workers.
On the interagency task force update briefs, on behalf of the governor, I challenge the staff to make sure that they are watching out for each other, taking care of each other. Also, we challenge them to tell us, look to your left and your right and tell us who is your backup. We ask people to brief different briefers each week to make sure that we have those backups. And as far as it relates to National Guard personnel, one of the most sacred roles of the senior enlisted leaders in a military organization is to look out and watch out for the welfare of the men and women in that organization, the troops. And our folks in the West Virginia National Guard are led by some of the best senior enlisted leaders in the nation, and they're doing a great job of monitoring those young men and women and making sure they're doing okay. But I really do appreciate that question.
Give me just 1 second. Let me just add just this. If you think about all the different times that we bring up, the courage about people crawling out of bed and going to work and going right into the fire and going right into where the COVID situations are the worst, and over and over and over they've done it for us, and all the people that are just going to the grocery stores, and from the standpoint of working in the grocery stores and doing all the different things that people have done all across this state. You know, they deserve so much credit, and that's why we try to continue to pass those accolades on to them, because they are doing unbelievable work, and they're tired, and they've worked unbelievably hard. With all that being said, though, just think about, they are receiving from God above the greatest reward that I don't know how you could receive a much greater reward. They are saving people's lives. They are actually touching a life and saving people's lives. And so I don't know how we can do more than just thank them and love them and just absolutely appreciate them, but boy, they have done really great. And so I thank Dr. Amjad and, you know, Dr. Marsh and, you know, our secretary and our great general and all the great work that they've done. But boy, oh boy, you know, it's a wonderful question, and it's a wonderful question because of the great work West Virginians have done to help West Virginians.
All right, thank you, Paul. Next to David Beard with the Dominion Post.
Hi, I was doing some reading this morning on how some other states are failing with their vaccine programs. And a specific instance I wanted to talk about was there's some areas where the vaccine clinics get massive numbers of no-shows for their appointments. So they get these they may have to throw away hundreds of doses, or they have situations where people hang out at the clinics all day hoping to grab an unclaimed dose at the end of the day. And looking at our numbers, I don't think we deal with that in any kind of scale here, but I wonder if we have instances of no-shows here and there, and what you do with the unclaimed dose when that happens. Do you have a standby list, or how does that work? Thanks.
General, please, you can answer this better than I.
Yes, sir, Governor. So, David, we do work with each of our entities that are doing the clinics to make sure that they are prepared for no-shows and to have backup lists. We ask them to continue to focus on those age requirements and the targeted population. But if there are occasions where they cannot meet that, and it's a matter of getting a dose in an arm, we ask them to get a dose in an arm. So you may see circumstances where somebody outside the age bracket may have received a dose, but the most important thing is we got a dose in an arm, and those tend to be from those circumstances that you just described. But we are, Governor and his team are exceptionally proud of the work going on at the local level clinics to make sure we do not waste a dose.
All right, thank you, David. Next is Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers. I guess two quick questions, or you can answer one of them. First of all, with numbers coming down, particularly with deaths and with hospitalizations and active cases for that matter, our testing numbers are also continuing to go down. I know that doesn't really account for the hospitalizations and death numbers, which are certainly positive numbers, but are we concerned about testing numbers going down? I know we're focusing on vaccinations. And also, in regards to what we just talked about with the Walgreens program, we obviously didn't take part in phase one, which was the effort to do the vaccinations at nursing homes and long-term care facilities, choosing to go ahead and do that up front. I guess, why are we deciding to go ahead and participate in phase two? I guess we must feel better about the process then. Those are my questions. Thank you.
Okay, Clay, maybe you can lead off, and General, if you could back up Clay just a second here.
Yes, thanks for the question. You know, when we look at the DHHR website, we're still averaging 10, 11,000 tests a day. So even though we have reached more steady state, I think with our testing, we're still being relatively aggressive. I believe the last time I heard, we were 16th in the country related to per capita testing. You know, as we go forward, the issues about testing are changing just a little bit, because not only do we want the volume of testing, and that's important, you know, related to detecting the transmission rates in different counties, and the governor went over the map, and we're happy that the map is starting to change, in a way that we're seeing with hospitalizations and other parts of our metric list. But also important that we start to track the genetics of the virus, and we are developing that capability for our in-state use, so that if we do, happen upon a cluster and we look at a sort of a group of, a certain percent of the positive tests, we'll be able to define whether we see any of those variant virus types, whether it's the mutants that have been reported in the United Kingdom and South Africa and Brazil or others, so that we can be ready for that part of the pandemic as well. And General, I'll turn it over to you.
Thank you, Clay. Stephen, so two completely different circumstances. We opted out of phase one because of the nature of what we were working towards with nursing homes, assisted living facilities, and the access to those local pharmacies and those facilities. And in addition to that, in phase two, opting out would have meant just to lose the 5,800 doses. So instead of opting out, what the governor directed us to do was go in and work with the federal government and with Walgreens, who was the chosen participant in this first rollout, to change the dynamic to make sure that it was fully integrated into our system. And I will tell you, over the weekend, we worked countless hours with Walgreens senior leadership, both regionally and nationally, to make sure that they were fully integrating with this. And we appreciate their work and efforts in this regard.
All right, thank you, Steve. Next to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass. Thanks for taking the question. It's Baby Dog's world, and we're all just living in it. So congratulations to Baby Dog. There have been two very powerful groups which have been reaching out to me over the past several weeks, months, actually, and I'm sure they have to every reporter. One, of course, are teachers and teachers' families concerned about being vaccinated. The other group, senior citizens and their loved ones who are wanting them to get vaccinated. And when we see the numbers of vaccinations, and obviously we're over 100,000 with 1 or 2 doses of seniors, but we have 350,000 seniors in the state. And the governor decided to vaccinate teachers 50 and over before we start back to school. How much thought was given into those two very important groups from the medical experts and the governor, you yourself, about taking those teacher vaccinations basically from that 65 and older group where they could have gone? You've mentioned that we've saved a lot of lives 65 and older. On the flip side, any vaccine that didn't get to someone 65 and older could have cost a life. So, I mean, I don't know if there's any instances where that happened, but there are a lot of people saying that 65 and older West Virginians should have remained the priority instead of siphoning off tens of thousands of doses to teachers, where your scientists have said that classrooms are some of the safest place to be in West Virginia. And it seems like perhaps those doses might not have been needed, at least scientifically speaking. Thank you very much.
Well, Kenny, I appreciate the question and everything. Let me just answer it, guys, because, there was a lot of thought that went in, and at the end of the day, I stand by our decision. Now, we made that decision to move on our schools from a standpoint of, and our, teachers and our service personnel, because we wanted to protect them just as well, because our most precious gift is our kids. We had to be in school. We absolutely wanted the anxiety level of our teachers and everyone to be lessened, did we not? And in doing so, I think that we probably vaccinated plus or minus 20,000. And in that, in the scope of what we're doing, it was the right move. And I'm very proud that we made that move. Now, there was probably some delta in between 51 and 65, and let's just say that was, 5 or 10,000 of the people and everything. But we made that move for our kids, did we not? We made that move to absolutely try to ensure ultra safety at our schools, and we knew, and we still know today that we can't make it just perfect. But we made that move, of course, way, way before the CDC came out and said, it's okay, you know, for our teachers to go back to school with no vaccinations and everything. You know, I don't think that that's okay. And I don't think that it would be running as smoothly as it runs right now without the move that we made. Not to say, you know, that the teachers' unions would have done this or that and all that kind of stuff, but we had to have our teachers back in the classroom and be back in the classroom feeling good and as safe as we can possibly be. We had to have our schools reopened. And so I stand rock solid by the fact that you can put that decision wholeheartedly with me. And, you know, at the end of the day, it was the right decision to make.
All right, thank you, Kenny. Next to Mark Curtis with Next Star Media.
Good afternoon, Governor and staff. And let me follow up a bit on Kenny's question, because I've been getting a lot of calls in the last 2 weeks from teachers in Putnam County who are age 50 plus, who have not gotten their first shots yet. Now, I understand from a call this morning that they're going to have let Hurricane High School out 2 hours early Friday for all the teachers to come and get their second shots. But what happens to people who fall through the cracks? We have teachers who are 50 years and older who have not been vaccinated. And I assume if this is happening in Putnam County, it's probably happening in other counties as well. And how do you deal with people who may have fallen through the cracks?
Well, Mark, let me say this, you know, and then I'm going to defer this to General Hoyer. But I can tell you that for what I know, you know, really, we can't force people to take the vaccine. And when we roll in and they don't show up, or they make the decision that they're not going to take the vaccine, for them to call now and say, well, I haven't got mine, you know, I think what we should say to them is just this, you know, we can take the horse to water, but you can't make the horse drink. I mean, without any question, you know, they've had the opportunity to have their vaccination, and we will double back, and we will continue to try to double back and help them in every way we possibly can. But to call up now and call you and indicate, well, gosh, I haven't had mine, you know, I mean, that's about as fair as I can fly through the sky, too. You know, so General, go, please.
Yeah, Mark, so just make sure we understand that when the governor directed us to work through this process, the State Department of Education reached out to all 55 boards of education and superintendents. Those counties were directed to provide us with a list of those people over the age of 50 who would take the vaccination. Those numbers were then aggregated together and doses were made available and clinics available for those. So if there are those who fell through the cracks during that process, it must have been related to a local level issue between communication. And as the governor said, as we can make doses available for those going forward. But rest assured that we provided the total number of doses that were presented to us by those 55 counties to the State Department of Education.
All right, thanks, Mark. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I want to follow up on Stephen's question. General Hoyer, could you give us a little bit more information about the mechanics of that relationship? When you say that Walgreens is now integrated into our system, so they're using names off of our list, but they're the ones in charge of administering those? Are people going to be notified the same way? It sounds like this is kind of a separate program. Is this count towards our total allotment, or is this different? Thank you.
So Charles, it is a 5,800 additional doses over and above the normal Operation Warp Speed allotment, which this week is 28,800 doses, an increase from that 23,600. So what we chose to do is to opt into this program, but the governor directed us to make sure that it was fully integrated with our efforts. So Walgreens will receive lists based on the counties in which their stores are located. That'll be coordinated across the interagency task force, the county effort, and then those doses go to Walgreens. Initially, they will make the appointments for those individuals that they're provided the names for. But as we continue to move out with the development of our Everbridge system, eventually Everbridge will allow for us to make those appointments and tell that individual to show up at that specific store for the vaccine. In addition to that, the work we did this weekend with Walgreens is we will have a system in place to automatically register an individual for their second dose if it's a Pfizer or a Moderna vaccine.
All right, thank you, Charles. Next to Emily Allen with West Virginia Public Broadcasting. I think we may have lost Emily, so we'll go to next Joe Severino with the Charleston Gazette-Mail.
Hey, everybody. So I asked a couple weeks ago about the state's outreach into minority communities for vaccines. Governor, you said this is something that you wanted to put some oomph behind, and that has been happening locally around Kanawha County. But I'm just wondering, what that looks like statewide, in regions like the Eastern Panhandle where we have large communities. What work do we have to do statewide in that area now? Thank you.
Well, Joe, I appreciate the question, and General Hoyer, maybe you could go in and Dr. Amjad could follow up and everything, and tell of all the work that has happened, and we continue to just try in every way we possibly can to make things better and better, and we're gonna make sure the work gets done. But nevertheless, General, go.
Yeah, Joe, a lot of work by DHHR with the minority task forces, and there are rollouts going on of initiatives to target minority communities. And I believe Dr. Amjad may have more specifics on some conversations that she had this morning as those roll out.
Sure, Joe. We have a task force, the African American Task Force, and Reverend Patterson has joined that with us and the JIATA team, and he's actually working on getting some grants. He's currently working with testing strategies, but he's going to be working with us to be doing some vaccination clinics with a mobile testing unit that he has. So Reverend Patterson is joining us with that effort. He was on our call last week with us and possibly be joining us again, but he's going to be helping with vaccinating efforts across the state and along with some other stakeholders as well. But those are just some of the things that we have to address some of the minority population across the state. But we'll have more to follow with that as we have more information, as we get more vaccines available in the state. Thanks.
All right, thank you, Joe. Governor, I'll turn it back to you.
Okay, well, I want to step back to the teachers and service personnel just a second, and our effort to try to get, our schools, running in as stress-free way as we possibly can, as safe as we possibly can for our kids and everyone involved. But one thing that needs to be pointed out is just think about this, and I'm bombarded with this stat: 97% of the deaths in West Virginia are from age 50 and above. And that's what we went in at with our testing or vaccinating there, rather, at 50 and above. And so I think I still stand by the decision, a good decision, and I hope and pray that we never have a situation that happens with our schools. And I say over and over, we can't make it perfect, but we can sure make it as safe as we can feasibly know how to do. I want to say another thing, in regard to this is, there was some news that just came out this morning that the Pfizer vaccine manufacturing was really ramping up, and it was going to jump up big time in the next very, very short period of time. Right behind that, you've got Johnson & Johnson going through the approval process. I think Pfizer may bump up in the amount of vaccines even before we get Johnson & Johnson through and approved. But that's all good stuff. I think you'll see a day come very, very soon in West Virginia to where you see a flood of vaccines available And when that happens, you will see our great people that are on the ground have them in people's arms like you can't imagine. Now just think about this. Just think just a second about this. Do you remember not long ago, when everybody, when I said I am hopeful, I am an optimist, but I am very, very, very conservative in my views, but I am an optimist in the way I think. I said I was very hopeful that by March the 15th, we would be really rolling in the state of West Virginia as far as the vaccines. Well, we've already beaten that. We've already beaten that substantially because we've gotten 325,000 vaccines in somebody's arm right now. Some of them are second shots, but the number is staggering, to be perfectly honest, with a population of around 1,700,000. So with that, we've already way beaten that March the 15th date, but I'll tell you again, as I had a lot of naysayers that were out there and they're saying, oh, the governor's crazy, there's no way in the world that we're going to have this by March the 15th. Most people are thinking it's going to be midsummer. Well, I was right about that. And I'm going to tell you something else that I believe. I believe in the next very short period of time, we're going to have a situation to where we will have vaccine production that will enable us to do significantly more than we're doing right now, and significantly more all across our country. Now, that's the good stuff. Now let me shoot a shot across everybody's bow and just say just this. As you see the better numbers, as you see absolutely from how, our daily positivity rate and our cumulative positive rate and our graphs that are separating on active cases and recovered cases, and you see all of that, please understand it's time to smile, it's time to be a little happy, but it's not time to celebrate. We still got a long ways to go. This thing can turn around and whiplash on us. The variants are absolutely a concern, meaning the different strains of this that are spinning off. Absolutely, we've got to get our people vaccinated. By the more we get vaccinated, probably the lesser situation that we'll have in regard to the variants. It is not time to celebrate, West Virginia. It's not time to drop your guard on your mask. It is time to absolutely do what I said before, keep your chin up, but wear your egg-sucking mask. Now, with all that being said, West Virginia, just keep on doing what you're doing. Stay together. We're absolutely getting through this. It's not easy. It's not easy stuff, but don't celebrate right yet. There's no point in, you can smile a little, you can laugh a little, but at the same time, right now, buckle down. Buckle down, West Virginia. You're getting through it and everything. Keep all these people in your thoughts and prayers. 2,131 great West Virginians we've lost. Keep them in your prayers, and we'll get through this, West Virginia. But just stay on guard right now. Don't drop your guard, please. Thank you all so much. God bless.